Okay, young women resorting to plastic surgery for social media perfection have driven down the average age of those going under the knife to below 40. Apparently, the pressure to look good on Facebook, Instagram and other sites is fueling this demand. Not just women, the average age for male cosmetic surgery has also gone down in the last 5 years from 47 to 45. Controversial. To discuss this, I'm joined from central London by the Harley Street facial cosmetic surgeon, Dr. Julian De Silva, and the best-selling author and broadcaster, Kathy Lette. Thank you both for coming on. Doctor, if I can start with you, how often does someone walk into your office and say, I want something done because I want to improve my social media looks?
I think that's a very good question, and I've really looked at my patients over a period of time, and I specialize only in the facial cosmetic and plastic surgery, and so all the patients who've come to see me over the past few years are only looking for really facial features. And when I looked at my patients over a 5-year period, I found year on year there's a steady dramatic increase in the number of patients who are really coming to see me regarding photographs and images that they put on social media. And certainly the growth of Facebook, the growth of Instagram, many young people are taking lots more photographs of themselves and seeing a much greater detail and imperfections in their face than ever before. And I think this is a trend that is only set to continue.
Okay, Kathy, what do you think of that, listening to that?
Well, I think it's something that really affects women much more than men. The research shows that 28,000 women have cosmetic surgery on their face a year, whereas only 2,000 men. So women suffer from facial prejudice. We get judged on our looks in a way that men don't. I mean, for men, wordplay is foreplay. How else is Woody Allen still doing the horizontal tango? And I just wish men would learn to read between our lines. You know, it's all there, the books, the babies, the laughter, the love. Why do we want to wipe our whole personality slate clean? But what we've realised is that beauty is one of the most lovely and natural things that money can buy. And our mothers told us that beauty comes from within, but obviously within a jar marked, Botox or collagen. But, I'm against cosmetic surgery. My mother told me never to pick my nose, especially from a catalogue. So I just think we should be allowed to age gracefully or disgracefully and stop being judged on how we look.
There you go, Doctor. Kathy's against cosmetic surgery. I'm sure it's a question you're asked a lot. How do you feel about people coming in and the only motivation being to look better in photographs? It's a tough one for people who maybe aren't going into the office and seeing you to accept as a reason to do it.
I think it's always very easy to be judgmental on what other people think, but there can actually be many reasons why different patients can come and seek to have cosmetic or plastic surgery. And just to give one example, there's some patients who say may have a large nose or a nose that's unsightly. Well, often these patients may have been teased, they may have been bullied, and there may be breathing issues. And so there can be multiple reasons why patients may look to improve themselves. And we all live in a modern world, and undoubtedly your appearance is important. And if there's something that affects you and affects your confidence in this day and age, isn't it reasonable to do something about that?
Yeah, so Kathy, just to throw that back to Kathy there, everyone's body is their own, and it can be for whatever reason. Some of them may, as the doctor said, be down to bullying or self-esteem issues and things like that. What's the problem? It's our own body, it's our own face.
Well, the two problems, first of all, if we all start to look the same, it'll be a case of send in the clones. And also, cosmetic surgeons are not very well regulated. There's a lot of cowboy clinicians out there. I mean, some of them, they couldn't even put a dressing on a salad. I think the reason they wear those little green masks is so they won't be recognised after it all goes hideously wrong. So it can be very dangerous. People die during cosmetic surgery. Olivia Goldsmith, who wrote The First Wives Club, died during a liposuction operation. Nobody ever talks about this terrible downside. So I just think we need to learn to celebrate our idiosyncrasies and our eccentricities and our difference. And, I think people would be much more beautiful if they read a book now and then. And the only cosmetic surgery I think women should have is cutting up their credit cards that they were going to pay for this ridiculous, beautification.
Dr. De Silva, let's throw that back to you, the regulation in the work that you do, your right to defend, obviously.
Well, I think when it comes to cosmetic and plastic surgery, of course, there's difference in standards and difference in results. Certainly most patients who come to see me are not looking to look different. They're looking to look like themselves only better. And so there isn't like a standard cookie cutter approach to good cosmetic and plastic surgery. It's about tailoring surgery to every individual patient and making every individual patient look better but still look like themselves. And that's what the definition of natural looking result is. In terms of regulation, well, the UK has one of the most stringent regulation systems in the world, and patients fly to the UK because of its well-rounded reputation and safety. Absolutely, there have been some tragic cases where patients have had bad results or injuries, but actually when it comes to those terrible incidents regarding death, most of those have been incidents that have actually occurred outside the UK. We have very tight regulation. The GMC looks after all doctors and surgeons performing cosmetic and plastic surgery. We also have an incredible regulation in terms of our hospitals and facilities, the Care Quality Commission that regulates all hospitals and private providers. And so we have a very in-depth regulatory system. Now, it is true that there are areas of cosmetic surgery, the more non-surgical treatments, where the regulation is less stringent. And there have been calls in this area that regulation should be tightened. And certainly in terms of giving Botox and fillers, well, you don't have to be a doctor, you don't have to be a nurse, you don't necessarily to have medical understanding and knowledge of the underlying anatomy of the face in order to give those treatments, and surely there is a need for that. However, when we talk about cosmetic and plastic surgery, we already have a good amount of regulation, we already have good practice, and really it's a question of making sure that every patient has the best possible care.
Just quickly want to ask you both, I know you're desperate to jump in, Kathy, but just for the interest of time, just want to quickly ask about men. Doctor, just very quickly, what are the most common things men come to see you for?
Well, men coming to see me to have cosmetic and plastic surgery, in some ways it's difficult to generalize and say, all men are looking to have this kind of particular treatment, because most patients who come to see me, well, they're really coming to see me about something that has bothered them for a long time. It's usually patients who have been in the back of their mind, they've had something that maybe for 8 or 10 years they've been thinking about. It's not usually something that they've suddenly thought about in a few weeks. A common thing for men might be rhinoplasty, where a patient may have a large nose or a nose that's imbalanced out of their face and would be looking to improve that. Another common request would be a chin implant, because the chin and the lower part of your face is very much a male part of the face. And so certainly most patients who come to see me, well, they're very specific in what they're looking to achieve. They're certainly not looking for something like a generalized approach.
Okay, Kathy, must throw back to you. Social media, is it making all this worse?
It's making it so much worse. But it's also the television industry, because 85% of people on British television over 50 are men. So we never see women who look normal. So it becomes abnormal, which is why women are heading off for all the Botox. And I have a friend who's a pediatrician in LA, and he was saying to me, none of the babies are hitting their developmental milestones. And I thought, well, I know why. When you've got a little baby and you're going, I love you, baby, and the baby's looking and you're smiling. If you're Botox, you're going, I love you, and the baby's going, I love you. There's no personality. So it's a bad thing for society that we can't express ourselves and be ourselves and be accepted for who we are. So I just think dimmer switch, greatest beauty aid known to womankind. Keep the lights low, girls. And also, why would you want a man who only wants you because you're silicone from tonsils to toenail? You wouldn't want a man like that.
The dimmer switch also works for men. I'm sure that's true as well. Doctor and Kathy, thank you very much indeed for your time. Appreciate it.